in first opinion, I have 15 minutes, not always. So when the patient comes in, I already see behavior, I'm looking at that. And I do look at eyes more than anything, but because it's what I do. But I think we all do that. We talking to the client, but we actually looking at the pet. We having a chat. We say, how are you? But you actually not paying attention to the conversation. You're actually having a look at the pet. So in the same way, I can see, well, is it bumping into things? Is it the eye looks a bit red? Is it? And then the next thing that I do is I get a bit history, and I see whether the dog eyes. I do a bit of a menace response, with the dog, because you want to know whether the pet sees or not. But pretty much the next thing I'm going to do is going to be the symmetry test. I combine this with neuro-ophthalmology, which is your tassel and your PLR and that. But to do that, you're going to have to put some lights on the eye. You're going to make the eye tear a little bit. So I tend to do the symmetry test before that. It may not make a big difference, but I try to follow a step by step, And then reasons for dry eye, there are many. The most common that we know is immunomediated. You see, these small breeds, usually with lowish tear production. And remember, it's the aqueous. It's not, the tear has two layers, and you're actually looking at the aqueous. And that's the reason sometimes it looks like an infection, because you see the tear has a mucin and you have that lipid layer as well, produced by the meibomian glands. So if you are losing the aqueous, what you are left with is with a bit of a thickened mucopurulent-like thing that many people confuse with infection, right? And usually bilateral, but you could have dry eye for several things. You could have a dry eye caused by toxicity, for instance. Did you know paracetamol can cause dry eye?
No, I didn't know
It's
that.
not that common. We put a lot of pets on paracetamol, a lot of dogs, but it can cause it.
Is that it causes a permanent dry eye or a transient?
Usually.
Wow.
I haven't seen it done often, but when I've seen it, I haven't seen them recover it. And when you find a symmetry test of 0 with only unilateral, this pet presents with an ulcer as well. And then they have that side of the nose dry, then you have a neurogenic dry eye, you have completely different treatment. And then there are other things, there are a few causes for dry eye. And then you also have the treatment, the common treatment that we use with cyclosporin. It doesn't work at the beginning. You have to keep going for a couple of months sometimes while you actually helping putting some the artificial tears to help out. So some people, they give it 3 weeks and they say, well, this is not working, I'm going to stop because this tube is so expensive.
Yeah.
Counseling the owner is important as well. And we just talking dry eye. And most people that I meet, the only thing they understand from dry eye, or they actually tell me they understand from dry eye, some dogs have dry eye, the shimmer test is low, I'm just going to put it in cyclosporin. That's not the end of it. There is a lot more. You see, there are patients who don't, they don't respond, that you have to use alternative medication. There is a lot. So ophthalmology is actually very cool, but if you don't know, then you'll be scared of it. It's a bit like, me being scared of orthopedics.
Yeah. And
even though I used to do cruciate ligaments and that, but that's because I'm old.
Yeah.